Today on Fuel Your Wellness, we'll be talking about acupuncture with my special guest, Dr. Jackson. Welcome to Fuel Your Wellness. My name is Ashley. I'm a registered dietitian and wellness enthusiast. I help individuals ditch diet culture, use food as medicine, and become plant-based pros. As you may know, I am looking at health and wellness through a holistic lens. And so today I have a very special guest, Dr. Jackson. Welcome.
Thank you. Thank you. I'm excited to be here.
Absolutely. We're excited to have you. And I just want to give a little introduction. Dr. Jen Jackson is a doctor of acupuncture and Chinese medicine, and she is also dedicated to the ancient art of healing. So today we're going to have a really great discussion about acupuncture and how that can fit into your wellness journey if you're on one. So I'm excited to get started, and I know for a lot of people they might not know what acupuncture is, so Can you kind of tell us what your definition of acupuncture is?
Sure. So acupuncture is a way that we can heal our whole system. It's a holistic approach to the body. And what we look at is the energy in our bodies. We all have energy, we're all made of energy, and so when we work with that energy and we find balance and harmony in the body with the different tools that we use through acupuncture, that's when we can have full health.
Awesome. Cool. And I love that because, you know, some people watching might not know what acupuncture is, and sometimes people are hesitant to try something new. So I love that. And I know for some people, they're a little bit nervous about needles. So can you tell us a little bit like how those are used in the practice?
Sure, yeah. So the way that we use our needles is an individual approach. Each body is different, and so we approach each body that way. The needles themselves are individually wrapped, sterile wrapping, and they're disposed of after every use. So it's a one-time use type of thing, and they get disposed right away. Some people are nervous about the size, and so there are all different sizes of acupuncture needles, but they're basically the size of a hair, the width of a hair.
Wow.
So they're very tiny, especially when you compare them to, say, needles that you receive through injection at a doctor or to take your blood for blood draws. They're very tiny. So
that's a good point. Yeah, because I have gotten it done before, and I'm like, it's not what people might think it is.
Yeah.
So if you're nervous about needles, don't be nervous. It's definitely not like a painful experience by any means. It's relaxing.
Yes, it is very much. And there are moments and points that you may feel a little bit of a pinch or a prick, and then it goes away immediately. But it's not the same as if you're, again, in a doctor's office and they're giving you an injection. It's a very mild experience compared to that.
Okay. Yeah, from what I remember, it's just like, that initial feeling, and then once that's gone, it's just like pure bliss.
Yes.
in my experience. And I know what I went for in particular, but I'm curious, like, what is the most common reason someone might come see you for acupuncture?
Yeah, great question. So I would say the most common reason that people come in is pain. You know, the media has done a great job of sharing that acupuncture works for pain, and it does. Chronic pain, acute pain, acupuncture is really effective for that. What we've also seen, though, is when people come in for pain, they'll report, 2 or 3 treatments down the road, oh, I'm sleeping better, or oh, I have more energy, or oh, my allergies aren't as bad, my digestion is better. So when we say a holistic approach, it really is. We're treating the pain and what you're coming in for where it is painful, and we're treating the whole system as well. So if your system needs support somewhere else, we'll probably find that and help your system overall.
I love that. That's definitely like what the definition of holistic is, and I love getting down to the root of the problem.
That's right.
You know, people who have worked with me know that that's kind of my motto, is like, we have to get to the root of it. And I love that it helps other areas, because, you know, when it comes to lifestyle medicine, I always look at all the different factors, because I think with dietitians in particular, people think, oh, we just talk about what you eat, and I'm like, there's so much more we talk about, because sleep in particular is one that I find is really affected by food, and food's affected by it.
Sure.
So it's definitely a big conversation starter as far as like my practice. So I'm sure if it's helping with like the root of the problem, I'm sure people really get benefit from that.
Yeah, absolutely.
My other big question for you is, what are some misconceptions like you've heard of about acupuncture, if you've heard any?
Yeah, I mean, I think probably the biggest one that pops into my brain is that it hurts, you know, and that it, you know, it's the worst thing ever. And that is so far from the truth, you know. Again, each person's system is different, and there are some people who are a little bit more sensitive. And so if that is the case, we will work with that person and work with different needles. But it is not painful at all. You know, you come in either on the table for about an hour, just relaxing, you know, and we don't get that opportunity a lot in life.
Yes,
so
especially as a mom.
Yes, definitely. So to be able to take that time to really give your body the opportunity to get into that rest and digest system, you know, is a really great opportunity, I think.
Love that. Yeah, and I always say, like, the body is a self-healing machine, but sometimes we need those tools to help us with that. And if we're going all the time, we're not in that rest and digest and heal state. So love that it helps with that. So if you were to kind of describe, like, from walking in to exiting, you know, what would that look like for a session for acupuncture?
Sure, great question. So we do have I guess two different types of treatments we have for acupuncture, and in the sense of we do have a new patient acupuncture treatment, and then we have just a regular office visit.
Awesome.
New patients, they'll experience more of an intake. We really like to go through, I wouldn't say each system, but definitely the systems that are, you know, the ones that we need to focus on. And then if it's pain that we're coming in for, then we will ask about the different systems in more detail, in more depth. And so, you know, that treatment is a little bit longer. It's about an hour and a half. And then for regular office treatments, we will do a little bit of an intake in the sense of follow-up history type of thing. You know, how did last treatment go? What was that like? So that'll be a little bit shorter period in the beginning. But then once that's done, we invite our patients to, you know, lay on the table, get ready for treatment, and then when we'll then take pulse, I guess, you know, look at tongue. Some of the practitioners look at the tongue.
Oh, wow.
Yeah.
Okay. What can that tell us?
So pulse and tongue give us the overall picture of what's happening in the system, what's happening in the body. And so that's how we come up with our diagnosis.
Oh, awesome.
Yeah.
Wow. So you just like kind of inspecting, I know like at the dentist they do that. So kind of similar, you just like look around at it.
Yeah, so it's not so much inspection probably as close as the dentist in the same way maybe. We look at the top of the tongue, we look at the color, we look at the sides, we look at the underneath, and all of that gives us a picture of what is happening in the system. And the same thing with the pulse. We read the pulse and listen to the pulse, and that gives us 12 of the different systems in the body for us to kind of give a diagnosis, find out what we need to focus on the most, and go from there.
What are the different systems, if you don't mind me asking?
Oh, sure, yeah. So let's see if I can go through all of them. So there are 12, and we have, oh gosh, do you want me to go through all of what?
Just like the common ones, maybe.
Okay.
Like what you usually see maybe have issues often.
Yes, okay, I see. So what we look at is, I would say most of the yin organs, we call them. And so those were the primary ones that we kind of focus on to help balance.
Gotcha.
And so when I say systems also in Chinese medicine, each system is named after an organ. And so it doesn't mean that anything is wrong with that particular organ.
Yes.
It just means that that particular organ is in charge of a system that may need a little bit of extra support. So, I mean, we really look at ones like spleen, liver, kidney are the biggest ones that we look at. Also lung, sometimes heart, and what we call pericardium. Pericardium is like the protector of the heart. So in the style that I do, we actually don't ever touch the heart or any of the heart points, because the heart is the emperor, and so no one has access to the emperor. We do all of our work through what's called the pericardium. So, and that's the protector of the heart. So that's the style that I treat in. There are so many different styles and different ways of treating. So the style that I've learned, that's what we have learned. Yeah.
Awesome. So the different systems. So I'm thinking, you know, from like physiology, I'm thinking like circulatory system and lymphatic system. Do you do anything like with the lymphatic system at all, or like
So
lymph drainage? I know, you know, that's a common thing people are doing these days.
Sure, yeah, absolutely. It's very important to maintain your health in your lymph system. So we don't actually treat it directly. The points that we do choose on the system can help move along the lymph and, you know, and help keep that system healthy for sure. Cool. So there is a particular type of treatment that people get that people are trained very specifically for manual lymph drainage, but we don't do that, as acupuncturists.
I know, so you do, is it yours called like a system approach, or what are kind of the different types of acupuncture or styles?
Yeah, there are different ones across the board. And so, I mean, mine is more of like a 5-element approach. Cool. Yes, because everything boils down to the 5 different elements that we're looking at. So, which includes all of the different systems, all the different organs, and all of their relationships. Awesome. So that's the one that I work with the most.
Cool. And with that, do you do, I know, you know, there's Chinese medicine, and even there are different ways of eating habits that relate to that. Do you ever kind of advise people to like eat certain things or help heal certain systems based on the food that they're
nutrition.
eating?
Sure, absolutely.
Awesome.
We
Cool.
do all get a nutrition class.
Cool.
There are some acupuncturists that definitely focus way more on nutrition, you know, because that's something that they have loved in their life and focus on that. So at our practice, we definitely give some recommendations based on a particular diagnosis that someone might have, a particular ailment that they're working with, you know, to kind of help their digestion system.
Awesome.
Yeah,
Cool.
and their whole system.
Cool. And my like personal question for you is like, how did you get into acupuncture? Like, what made you fall in love with it? How did you get interested in it?
Yeah, great question. So I'm a massage therapist as well. So I was doing massage therapy. I knew that I wanted to do more in the healing world, but I knew massage therapy as a full-time position, my body was not going to agree with fully. And so I needed to find something else. So I started on a journey to kind of find something else. And in my journey, I found that I came across acupuncture. And so at the time, I was having some hormonal imbalances. And so a friend suggested that I try it. And I said, all right, well, I've heard about it. You know, this was back, I think, almost 15 years ago. I've heard about it. There wasn't much out about it at the time. And I had heard about it through massage therapy. And so when I went to try it, I found that within 2 treatments, I was back to feeling like myself.
That's amazing.
So after those 2 treatments, I was like, okay, I think I found what I'm doing next.
I love that.
So it was definitely a process to get there, and it was definitely a process to figure out if I truly wanted to do that. Cool. And thankfully, I did figure that out, and it was a beautiful journey.
I love that. Yeah, that actually is similar to why I, you know, went to maybe like 4 or 5 sessions of acupuncture. Is similar. It was like PCOS, so I know that's a very common thing these days.
Yes.
That it's tough because like there's no specific diagnosis for some people. It's just ruling out of things, and so acupuncture was a great way for me to be like, okay, if I'm not sure, at least I can get some help with the symptoms of it, because
Sure.
that's really more so than anything kind of what's frustrating and the hormonal imbalances. So I found that that was like one of the most helpful things I ever did as far as that, because there's not much you can do for PCOS. So I found that very, helpful for me.
Sure.
So I know that might be, is that something that you often find people come in for, like hormonal things?
Definitely, more and more, I would say, because again, the media is, turning to acupuncture and understanding acupuncture can do a whole lot for the body that, we kind of lack in our Western diagnoses, because we are a holistic approach, we can work with the whole system all together and then help balance out those hormones. I wouldn't say necessarily easier, but just in a different approach, and we're finding that our patients are having a lot of effectiveness with the treatments.
That's great, because I know a lot of people who are having difficulty with hormonal imbalances or changes, and it can be really difficult. Like the symptoms that come along with that are really excruciating. Not painful all the time, but like excruciating and other emotionally excruciating and etc. So that's definitely something good to know. And as far as like the population you work with, because I'm assuming that would be a wide range, because everyone has hormones, you know. So what kind of is like the range of the age that you work with usually?
So I like to say I work with like 3 months old to like 92-year-olds. So our patients range in that range.
That's
I would say probably the biggest population is like between 40s and late 60s probably is the majority of our patients right now. And again, coming in for all different things, from allergies to insomnia, to anxiety, to depression, all of these different things that acupuncture can help with, along with pain,
That's amazing, because I know almost everyone has anxiety or has had anxiety, so that's like huge. And as far as babies, I'm curious, because I have a little baby, I'm curious, like what is it that you do for them or with them?
Sure, great question. So I do a style called Shonishin, and it's basically pediatric treatment. And so with that, I don't use needles like to stick into infants or even little kids. I use a brushing technique that I learned through my teacher who's from Japan. And so I've gotten to go over to Japan and study this actual technique with the person who created it. So it is really, really interesting. It's great to watch these little babies who don't know really what's happening in the sense of treatment, who just kind of like, they start kind of like a little bit of uncomfortable and cranky and, just sad, or, I had one baby who I think he was like 2 months old, and you could just tell his belly hurt, and he was like all crumpled up, and and his parents were struggling with this, and so we started treatment, and the treatment lasted maybe 10 minutes. It was very short, and by the end of the treatment the baby was like totally opened up, sprawled out, and just like so relaxed, I
love that.
So to be able to see that and to witness that change really quickly, it's really, really, really cool, is the only word that I can describe.
I love that, and because I love my little boy, and I know he had some reflux. So is that something common that you see in babies?
Absolutely. Yeah, absolutely. And I would say it takes probably, again, like with acupuncture, it's cumulative. So I would say it takes a couple of treatments to fully kind of get out of that rhythm of their bodies. But within the first treatment, parents report changes, and then as we continue, it's more and more changes that last longer, and they have better digestion, less reflux.
Absolutely. And I know as a mom, I'm always like, is this covered by insurance? Is this covered by insurance? Is that for like babies and for adults?
Sure, great question. So acupuncture can be covered by insurance. We do accept insurance. With babies and younger people, we don't really use insurance because we don't stick needles in. So that's like the what insurance covers is the actual insertion of the needles. And so, but our our prices for our infants, you know, and young toddlers and such, it's pretty close to a copay in that sense. Yeah.
Cool.
But for adults, we definitely accept insurance, and we multiple different types of insurance, and you know, we find that gives people more access, you know, to acupuncture that may not have been so readily available to be able to pay out of pocket.
Oh,
so
100%, because I know, again, you know, as someone who also takes insurance, I know like when I didn't, it was tough because, I mean, it's hard to afford anything these days. It really is difficult. But I know also it's tough to incorporate like holistic approaches sometimes because those things tend to not be covered. So I'm curious about like, okay, acupuncture is massage. What does that look like as far as the difference?
Yeah, great question. So typically in our office, unfortunately, massage is not covered. Massage can be covered sometimes under a PT, but for acupuncture, we have found up to this point it's not covered by insurance. So we haven't really delved into that area, but for acupuncture treatments,
I think it should be.
I know. More and more insurance companies are, you know, are covering the acupuncture. So, you know, if someone is interested, they can call their insurance company and find out, you know, if they have insurance coverage, you know.
It's fun to talk to them.
Yes.
I know all about that. But as far as, you know, I know one of the other things that you mentioned was craniosacral therapy, and I really wanted to ask about that because I'm genuinely curious about it.
Sure.
So tell me a little bit about craniosacral therapy.
Yeah, so craniosacral therapy is another modality that we offer, and it is a modality that we as the practitioner listen to the rhythm that happens in the spinal column for the cerebral spinal fluid traveling from the brain all the way down the spine and then back up again. It has its own rhythm that's different from our breath, it's different from our heart rate, it has its own rhythm, and you can feel that rhythm throughout the whole body. And so with craniosacral, we take time and listen at different, what we call listening stations, and listen to see if the rhythm is, I guess, equal and fluid, and if it's not, we usually stay with that particular area until the rhythm becomes, you know, that fluidness. And so the beauty about, I mean, I guess all the things that we do, it's like this, but the craniosacral is all about your own body, your own system, regulating and adjusting itself. And so we as the practitioners are basically the cheerleaders, you know, I like to say, and the encouragers. And so we are there basically to listen and to follow what your system is doing. And so your system is the one that unwinds itself.
Awesome. So is there, you know, a common reason people come in for that? Or is it the same probably as acupuncture?
Yeah, it's the same. A lot of time people will come in for acupuncture or massage, and we will bring up craniosacral and then we'll incorporate that at a later date to, you know, their whole journey, if you will. And so, but some people come in, migraine is really great. If people have migraines, craniosacral can be very effective. Jaw pain, people come in a lot with like TMJ, and we'll have that incorporated into their healing journey.
Do you do babies for craniosacral as
yeah,
well?
I wouldn't. I have. I haven't done a whole lot. I would say probably toddlers and up. Is what I've worked with. Yeah.
I just know because I was told that. So my son had a poor latch, and it was a not great experience for me as a breastfeeding mom for a couple of months when he couldn't latch well, and they mentioned craniosacral therapy, and I was like, oh wow, like I have to look into this more. Unfortunately, we did something else, but I was always curious because of that, so it makes sense. So it's kind of like the upper, it helps with like headache, jaw, anything related to, it sounds like the mouth or the upper body.
Yeah, and it really, I've had a lot of clients, patients who it's benefited their lower back too.
Awesome.
Like a lot of, if people are having any type of problems with their lower back, like their SI joint specifically, their sacral iliac joint, you know, a lot
I had
of times,
issues when I was pregnant with that too, so
a lot of times we find that people find a lot of relief with the craniosacral as well.
Cool, and I have a question too about How long usually is someone seeing you for as far as, acupuncture goes?
Yeah.
Is that like a couple months? Is that a year? Is it shorter, longer?
Yeah, so it depends. It's hard to answer that question because our bodies and our systems are so different, and we're coming in for different things. If someone comes in with an acute issue, I like to have someone come in, I would say 4 or 5 times, maybe 6 times in a row, like once a week, for 4 to 6 weeks to really kind of get into a better place. If someone comes in with a chronic condition, then we have that conversation about like this may be a little bit longer term solution. And so again, I like to ramp people up so their systems are online for that 4 to 6 week period, once a week for that time frame.
And I'm curious too, like, is it something that you can kind of come in once, if you have something acute, once you feel well again, is it something that you can kind of just come in regularly, like monthly or like a couple times a year even, to just help balance everything out?
Absolutely. We definitely have a lot of patients who come in once a month, just for maintenance and wellness and, just to kind of keep everything moving. Some people like to come in quarterly. I would recommend probably if you refer the wellness piece of it, no less than, I would say once a month is really great to maintain the wellness.
Yeah, definitely. Because I know that's the case. Like when I would do reflexology, I like to go like once a month, just even though I was healthy, I just wanted to like maintain that health. And I think that's important too, because I always give the example of, we brush our teeth every day.
Yeah.
So we don't expect our teeth to just naturally be clean. Like we have to put in a little bit of work and maintain that. So I always say that's the same with like every other system of our body. We have to maintain it.
Yes, absolutely.
Awesome.
Yeah.
Awesome. Yeah. Anything else you want to share with us about acupuncture? Anything else like craniosacral therapy, massage therapy, any tips you can give us, anything that you want to leave us on a good note?
Yeah, I mean, just that acupuncture is for everyone. That's my philosophy. Yeah. And, we would love to support people's health, as in a holistic approach, and really communication is key. So when you come in for treatment, to have the opportunity to share what's going on all together in your system is really important. And to reach out, when you need something, to have the opportunity to work with an acupuncturist is, I think it special and important. I'm a little biased.
Yeah, absolutely. No, I am too, because I've gotten it done and I've seen really great results from it. So I love it. I know that it's something that is perfectly, really, it goes well into a holistic approach with like nutrition. And I think people just really think nutrition and exercise are like the only things for health. And I always try to help them branch out. So that's why I'm glad I brought you here today to talk to you about it. And I'm really grateful that you came on today.
Yeah, thanks for having me and allowing me to talk about acupuncture. I love acupuncture and I love speaking about it. It does pair well with any type of therapy that anybody else is getting. Talk therapy pairs well with, and any type of Western medical treatments that people are getting, it really, really does pair well with too.
Yeah, I love that. Yeah, combine both, because it's not one or the other, it's the power of two.
Yes,
so, love that. Well, thank you again.
Thank you.
Thanks for tuning in. If you have any questions, you can feel free to reach out to us. Until next time.
The Dr. Martin Luther King Jr. Community Center is located in Newport, Rhode Island. Our mission is to nourish, educate, and support Newport County residents to improve their social, economic, and physical well-being. For more information, please visit our website at mlkccenter.org. We'd love you to come volunteer, or if you need help, please turn to us and we'll be there to support you.
Adoption Rhode Island is a private nonprofit organization dedicated to improving outcomes for children, youth, and young adults in foster care by finding families or other permanent connections. We also provide support service, counseling services for this population. If you're interested in learning more about adoption from foster care or about our support services, please contact us at 401-865-6000 or visit our website at adoptionri.org.